Voice killers, that's what we're talking about. Now, when I say voice killers, I am not just talking about the literal voice, although I am definitely including the literal voice in it. I'm also talking about core and pelvic floor killers, because the voice and pelvic floor are connected. And if you're not optimizing all three of those, then you're not optimizing even one of them, okay? You're trying to strengthen something in isolation, right? I'm gonna strengthen my pinky finger. Okay, what's that for, right? So we try to do things very functional. We don't isolate muscles. We work them as a group. Same thing with the voice to pelvic floor. You can't just isolate the pelvic floor or the core. So what is yet another voice killer? Because we all need our voice. You don't have to be a performing artist, but if you are, listen up. Musical theater, singers, public speakers, if you depend on your voice, teachers, then this information is vital for you. But if you love a good, strong core and pelvic floor, also pretty important. The next vocal killer is a snarky psoas. Now, if you Google snarky psoas, maybe my name, maybe not my name behind it, you're going to come up with a lot of information. I've written several things on what I call a snarky psoas. I've done workshops on it, etc. I teach a lot about therapeutic yoga. Shameless plug of one of my first book back there, Medical Therapeutic Yoga, because the psoas can't be held rigidly and you have a good voice or a good pelvic floor. Think of it as like a pulley system, right? If your psoas, your hip flexor, okay, is tight, then it's pulling on the respiratory diaphragm. It can also pull across the front of the hip labrum and also adversely impact basically length tension relationship of things being too tight so they're not very fluid and you don't feel very free. Snarky psoas issues can also just give you flat out frank low back pain and hip pain. It can mimic a hip labral tear. It can mimic pelvic pain, painful intercourse. It can cause all kinds of things. So if you have a snarky psoas, the first thing that I would suggest is it's not always about stretching out, okay? In fact, a lot of oh my goodness, I would say 85% of the patients I see, I do not have them stretch. I deliberately have them avoid stretching. So it's not just about stretching. If it was, you wouldn't need any of these videos, right? You could just YouTube some hip flexor stretch and be on your merry way. But it is a lot more layered and complex than that. The psoas is substituting for a reason. The psoas is snarky for a reason. What I call psoas speaking. You can literally recruit the wrong muscles to speak. Hip flexors, I've seen it, I image it, I've seen it for years in the clinic on patients. They will literally use their hip flexors to feel enough pressure and breath flow, airflow to create sound. Is it sustainable? No. Is it possible to do? Yes, right? So we want to make sure that that's not where your focus is, that your hip flexors are not being snarky, that your psoas isn't being snarky, okay? So that is another important voice killer. If you like this video, don't forget to subscribe, share it. If you have questions, you can leave them in the comments. I answer all reasonable comments. And if you have other concerns, you want to be seen, you want to have imaging done, etc., you have concerns about the voice that are pretty high level, then you can go to garnerpelvichealth.com. Thanks for listening.